where I'm not bothering people and I got a little bit of quiet. Hope everyone is well. Unfortunately, I just left my halava donut downstairs that I wanted to show off to everybody. I hope everyone's having a very happy Hanukkah. Aliza, thanks so much for a great wine event last night. It was terrific. Hopefully some of you enjoyed that as well. This is our last event. At least I know it's the last Wall Street and technology event. Aliza, you'll correct me if there are other events going on. But it's been a very, very busy year. Hopefully a lot of you have got a chance to enjoy them. We're going to have a great calendar again for next year that we're already trying to pull together. Hopefully lots of you will come up with ideas and participate and certainly join them. Really thrilled to have at this final event, Moshe Bellows and Maccabee Ventures. We calling it Maccabee or Maccabi?
Maccabee. We go by Maccabee.
We'll go with Maccabee.
If you're Israeli, you can go Maccabi.
So it's exciting. Moshe is going to tell us about Maccabee Ventures, and also appropriate for Hanukkah to go ahead and perhaps have the Maccabee Ventures also over here. But it's great. It's continuing a theme that candidly we were reluctant to talk about a lot of healthcare events once upon a time. This is probably our third or fourth in the last 18 months about healthcare tech. And it gets a tremendous response, and Moshe and Maccabee Ventures have really been at the forefront of investing in very cool health tech companies. And I'm very psyched both to hear Moshe and Avi and the whole team. And let me pass it off to Moshe for what's going to be a very exciting discussion.
Thank you, everyone. I will be super brief because I really want to get to our amazing companies. I wanted to share with the group, some of you know Maccabee Ventures and some of you don't. Can we see the screen?
Yes.
Amazing. So really quickly, Maccabee Ventures. Oh, that's interesting. So now it won't. There you go. Is a early stage venture fund that's leveraging the global Yeshiva University 70,000 strong alumni network, while also providing a unparalleled learning experience for Yeshiva University students. It's the fund's GPs are Bruce Terrigan, who's got 25 years at Blumberg Capital, and myself, 25 years at a family office. And it's an early stage pre-seed and seed fund, and we focus on these 6 areas. A beautiful corollary is that we get to teach 2 courses at Yeshiva University, Angel and Venture Capital, as well as Fund Formation, Administration, and Management, where the students get a year and a half experience, venture experience while they're still in school. Sorry, it's not advancing anymore. Great. And while they're in school, all these other classes get to interface and intersect with us. So strategy, marketing, and they all also get an incredible amount of experience, either doing projects for our fund or for our portfolio companies. And finally, to Yeshiva University, the benefits, Office of Admissions has a lot to talk about with the ecosystem. Career Services is seeing over 1,500 portfolio companies a year now, which means a lot more jobs. And then institutional advancement allows us to interface with alumni in a very different way. And also our fund is giving 15% of our profits to Yeshiva University. Bruce and I are both alumni, which leads me to the next amazing piece. She's on the call. I get to interface now with Aliza Abrams Koenig, who is now the new Director of Alumni Engagement. And she is engaging with alumni in a very, very different way. And so there are a lot of alumni on the call. We're now engaging with alumni in all the traditional ways, but also trying to bring them value. And so that's what we're doing today. And so I'm super excited to present. We're gonna have 3 of our portfolio companies presenting. And the idea is to bring our alumni value, end user value. You guys can be clients to these disrupting companies. You can make introductions. What we wanna do today is show our value, Yeshiva University's value to these companies. I believe we've done some of that, Bruce and I have, but now it's our turn to do that and to really build a super highway for these companies to get to end users. And I know that our partnership with Eliza has been, and with Lawrence, has been really amazing. Currently, we have 6 portfolio companies. This is our website, and this is my email address. If anybody wants to be in touch and learn more about us or any of our companies, I encourage you to be in touch. And now it is my distinct pleasure to introduce our moderator, Dr. Avi Fisher. Dr. Avi Fisher is the Divisional Vice President of Medical Affairs and the Chief Medical Officer at Abbott. Dr. Fisher has multiple areas of expertise, including heart health, wearables, digital health, and a slew more. Dr. Fisher joined Abbott through their acquisition of St. Jude Medical in 2012, where he served as VP of Medical Affairs in the St. Jude Medical Implantable Electronic Systems Division. In addition to his medical director role, he served as the team lead for training and education across the company's all of their products and therapies, which made him an incredible, our moderator of choice for today. Prior to joining Abbott, Dr. Fisher served on the faculty of Mount Sinai. He received his undergraduate degree from University of Maryland, MD from Sackler School of Medicine in Tel Aviv, and his residency at the Albert Einstein School of Medicine, a fellowship at Mount Sinai in cardiovascular disease, and a fellowship at Brigham and Women's Hospital in cardiac electrophysiology. But most importantly, Avi and I he's been a trusted advisor to me, and we have been friends for over 30 years. So without further ado, I introduce Dr. Avi Fisher.
Yeah, thank you, Moshe, for the kind introduction. There was a lot of complex words, so you did that perfectly. So thanks for that. Hanukkah Sameach, happy Hanukkah to everyone, and thank you, Lawrence. Thank you, Eliza. Thank you for the entire YU Professional Network for asking me to moderate this event. And I think I'd be remiss if I didn't thank everybody who at 12 o'clock on a Wednesday is taking out an hour to spend time in this event. So let me actually start by doing something very corporate. So I'm representing myself, Avi Fisher, and the opinions that you will hear that I express today are my opinions and don't necessarily represent those of Abbott Laboratories. So with that disclosure, I think we'd all agree that the times that we're living through are unique, and we're living through a great transformation. The technological enablement, digitization, all of the automation that's going on around the globe, these things are profoundly affecting so many industries today, and healthcare is no exception. For the past, let's say, over a decade, the U.S., for example, has spent more than 17% of its GDP on healthcare. Compared to the U.S., even countries like China, which spend far less of their GDP, about 6% of their GDP on healthcare, there have been concerns over costs and the rising costs of delivery of healthcare year over year. And this has really become a major concern globally. Virtually every country is now facing the challenge of the rising cost of healthcare. But beyond the simple cost, there are another whole slew of events and challenges that are being faced. The growing size of the aging population, again, very important in today's discussion. The rising prevalence of chronic diseases, things like obesity, high blood pressure, diabetes. These are becoming epidemic around the globe. And then there are the evolving and changing healthcare delivery models that are being entertained across the world. And when you think about that and couple sort of the changes that are occurring globally, as well as the technological advancements and all of the rapid innovation that's taking place, and the concept of integrating those into complex healthcare systems, one can really feel the challenges that will be faced. I think everybody talks about supply chain nowadays. So just let me talk about supply chain, right? On the supply chain, these new technologies need to be integrated into care delivery. And quite frankly, the technologies are driven by both immediate needs as well as some long-term goals, specifically providing greater precision medicine, reducing the number of errors when medicine is practiced, but more importantly, better predictive analytics and aims at translating care into better patient outcomes. So that's on the supply side. On the demand side, obviously, customers now have different expectations. Increasingly, today's patients want healthcare services to be delivered to them with greater efficiency, and importantly, in convenient, comfortable, and near normal settings. So as a result of everything I've just kind of blabbered about, the entire paradigm of healthcare delivery is changing, and the rate of change that is occurring will likely accelerate in the years ahead. Importantly, research suggests that digital interventions that support things like connected electronic health records, things like hospital automation, care coordination, patient engagement, and improved delivery of primary care and primary prevention, these can absolutely help drive payment reforms and ultimately deliver considerable cost savings to the system. So to sort of summarize, before we get into the discussion, I think it's fairly clear, hopefully to everyone on this call, that as the model of healthcare delivery evolves, there's a focus on embedding a core set of services that include connectivity into the broader ecosystem, with the aim of enabling healthcare professionals at all levels to leverage these digital services, leverage connectivity to deliver patient outcomes that are better than they have been, and to create a more integrated patient experience and to support more efficient work streams as time moves forward. So with that background, let me ask each of the discussants to provide a few remarks about themselves and their companies, and specifically how they feel that they're positioned to engage and be part of this changing paradigm of healthcare delivery. And you know what, I'm a simple guy, so let's start alphabetically. And unfortunately, Alon, I think your first name is the first if we go according to the alphabet. So not to put you on the spot, Alon, but let's kick it off with you representing Ilios Health.
Of course, and thank you, Avi, for moderating this webinar, and thank you for the YU community for inviting us, and for Moshe and Maccabee Ventures for backing Ilios. So it's really a pleasure to be here today. Just to give kind of maybe, I think, our origin story in a nutshell, and I think that's also connected to what you said, Avi. So we came into behavioral health. We were operating in the behavioral health space, really with the mission to empower clinicians and make their life easier, and essentially bridging the access to care gap and also the supply to demand gap that behavioral health is now facing. We're seeing an exponential increase in demand, and we're seeing a declining number of clinicians. And that gap is a barrier to both access and both quality of care in behavioral health. For me personally, I've seen that firsthand through friends and family members dealing with PTSD. I've seen them not improving for a long time. And that set us on this mission to really set the new standard of care for behavioral health. And so I think that to your question, really thinking about efficiency and thinking about effectiveness are the two main themes that now COVID has accelerated, and I think we should focus on for the years to come.
Great, thank you. Anurag, you're up next.
Thank you, Avi. Good afternoon, everyone. It's a real honor to be here today. And again, thank you, Avi, for moderating, and the Yeshiva community and Maccabee Ventures. Quick intro, my name is Anurag. My background is as a board certified emergency medicine trauma physician. I actually still practice on the front lines 1 to 2 Saturdays a month. And I've been dealing with COVID literally on the front lines in that regard. But I spent the past decade of my career really focused on the informatics and innovation side of healthcare across a lot of different enterprises. Launched Tembo Health 3 years ago. Tembo is a telemedicine platform serving the Medicare senior population. In our model, we partner with senior communities like skilled nursing facilities, CCRC, senior living, independent living, and so forth. And that partnership allows us to leverage the existing infrastructure to augment their capabilities to provide more complex and quality care. My passion for this space really came from my own personal experience. What my grandfather went through about 5 or 6 years ago now in experience, with senior communities. I found that there were real gaps in his ability to access clinical care, things like psychiatry, cardiology, neurology, emergency care. And so at Tembo, we've really built a platform to provide really tech-enabled healthcare services in a meaningful way that's really simple, easy for frontline staff to engage with us, partner with us, so that we can really, ensure that residents in these communities, seniors, are happier and healthier. And our mission really is to drive healthcare outcome improvement from a data analytics perspective.
Great, thanks for that background. Mehrdad, I think you're up.
Yes, thanks very much, Avi. Thank you very much to the YU community for having me. Thank you very much, Moshe, for inviting me, and to Maccabee for investing in our company. My name is Mehrdad Shafai. I'm one of the co-founders of HealthCare. HealthCare is a automatic billing system for healthcare providers. Our goal is to make it easier and less expensive to be paid for healthcare providers. And our mission is really to be able to reduce the administrative burden that I think Avi has touched on in his points, in order to reduce the cost of healthcare and to ultimately, hopefully, have the knock-on effect of improving the quality of care as well.
Great. Well, I think with those introductions and that background, I think that's a great segue. And Mehrdad, why don't we have you kind of get the first question here, and I would ask the other founders to chime in with their thoughts as well. But again, let's go back to the topic of the challenge of the administration of healthcare and the logjam that often occurs in the billing cycles, and things like increasing costs and the changing regulatory environment, and all of the changes to coding, not even to mention workflow inefficiencies and data security, and then implementation of new technologies into the system. So as you're thinking about all of these changes that are occurring, what are some of the strategies that you're thinking about and employing to help reduce that growing administrative burden?
Sure. So it's definitely a very interesting problem from the perspective of the mechanics. I'm and my two co-founders are payments technology experts. We actually worked for organizations that have developed payments technology for financial institutions and for large merchants for many years. So coming into the healthcare space and seeing the lack of standardization around the payments process was very surprising. It seems as though what really happens, and what to your point is continuing to happen, is that there are constantly new methods of reimbursement being proposed. So fee-for-service, value-based, risk-based. There's alternative payment models that are proposed as well. And it seems that every single one of these models is introducing an additional layer of complexity into the process of actually getting paid. And that complexity is ultimately what we believe has drastically increased the cost of getting paid in healthcare. The goal for us and how we feel we can potentially begin to address that issue is to act as an abstraction layer between the healthcare provider and the payer and the state and federal organizations that are responsible for drafting many of those reimbursement rules. And why we say abstraction layer is because if the healthcare provider is able to do their work and submit their information in a standardized way and then have our system worry about all the intricacies, then it makes their lives much easier. And so assuming the burden of helping them adhere to many of the requirements necessary to be reimbursed under the models that they operate in is really how we feel we can help reduce the administrative burden of getting paid for care delivered. Yeah,
interesting. And I appreciate that. I mean, I think those are really great insights. Anurag or Alon, any thoughts from you or
Yeah, sure. I like to think about the administrative burden also from just inefficiency perspective and workflow perspective. I mean, when we look at behavioral health today, then on the one hand, we have a gap of 250,000 clinicians, and access to care is problematic. On the other hand, clinicians today spend roughly a day a week just summarizing their sessions and writing progress notes. And so it's a very clear and obvious obstacle that if we can lower that administrative burden, if we can empower them and kind of automate that process, they can see more clients, that we can open that bottleneck and we can allow better access to care. And that's only on summarizing session, not talking about preparing for their session, not talking about charting, not talking about billing, etc. And the way we like to think about it is behavioral health is a very unique vertical in healthcare where both the clinical delivery of care, both the clinical content and the administrative content is based on language or conversation. In contrast, for example, for radiology, where a lot of the clinical work is based on imaging, in behavioral health, it's based on conversation and text. And that's why we believe that taking a technology like natural language processing, it's just a great application for that, because you can deliver both a clinical value proposition, but also an administrative value proposition, and create the baseline for those progress notes. And so what we've done and what we are seeing with the providers that we work with is a 50% reduction from 15 minutes that it takes a clinician to write a progress note on a 45-minute session without Elios to around 7-8 minutes that it takes them with Elios. And that is the first step. That is the first step to reducing the time that they spend on administration, allowing them to see more clients, open those bottlenecks, and improving access to care. And I think that's, only looking through the glasses of the administrative burden, not to mention that behavioral health probably have the highest staff turnover rate, close to 50%. And the number one reason is administration and documentation.
Great. You know what, I want to sort of build on some of these themes. And maybe I'll turn to Anurag for this question. As we've heard about the administrative, burdens and trying to adapt technologies and to address some of these needs, sort of a couple thoughts really that lead to a question. So how do you remain customer focused while at the same time being able to create solutions that are scalable? I guess this is particularly important, Anurag, for you. And as I mentioned, the growing aging population is real. So are there generational and demographic considerations, right? I sort of think of myself, I'm a digital immigrant, right? I didn't grow up with a smartphone. My children did. And so generationally, there are differences in the way we apply and look at these technologies. So how do you think about those solutions, making them scalable, addressing the unmet needs, but also keeping in mind the generational and demographic differences?
Yeah, great question, Avi. So for us, it's all about the user experience. At Tempo Health, what we've seen with telemedicine at large, and again, telemedicine goes back, more than 30 years now, with the VA, being the first large user of telemedicine, is really thinking about it from that user experience perspective. And at Tempo, we really create a lot of focus and energy on what does that experience look like for the patient, that senior resident, the nurse at the bedside in the nursing home who's facilitating the visit, for the physician on our end who's providing the care, and ensuring that we're able to build a platform and a system where we can really foster the patient-doctor relationship, where they can build trust, rapport, but also to ensure that our doctors have all the elements, the data that they need and they require to make meaningful diagnoses, treatment plans, and just, how do we get that data translated from the patient, from the nursing home to our doctors and so forth. In our model, in terms of thinking about, the aging population and so forth, one thing that we love about partnering with senior communities is that we're able to really leverage that infrastructure. We have integrations with our electronic health records. We've got the nurses, social workers on the front line. We invite family members to join all of our telemedicine visits as well. And so all of that amalgamation of data and information really allows our doctors to just have the best access to clinical information. And ultimately for the patients themselves, it's almost as easy as watching TV, because again, they have that frontline staff in the senior communities who are facilitating the visits. You know, they're turning on the telemedicine carts or iPads or whatever the community is using, and they're kind of making it, you know, they're lowering the barrier in terms of the technology aspect for the residents.
Great. Thank you. And you know, as you mentioned, you know, user needs and you know, I think the information you provided is extremely important in this context. How do you and Alon and Mehrdad chime in as well? You know, how do you think about creating that stickiness, right? How do you think about encouraging and facilitating user retention, right? Because there's nothing worse than somebody using something once and then not returning. And obviously, I think retention is key here. So how do you create that stickiness? How are you thinking about the solutions and keeping that user?
Yeah, again, for us, it really comes down to the user experience and ensuring that we're connecting all the dots so that we're able to deliver really world-class healthcare at the end of the day. And in our platform, for example, whether you're seeing one of our psychiatrists or cardiologists or neurologists, it's a longitudinal patient-doctor relationship. You're going to have this, if you're a resident in one of our communities, seeing one of our cardiologists, you're going to see the same cardiologist visit after visit after visit. And if you're really stable, you may not have a follow-up for 3 months, but let's say if you're a little bit unstable, getting a lot of medications changed or maybe some testing done, we may do a follow-up in 3 to 4 weeks or even as soon as 1 week if needed. So we're building that relationship. And I think, you know, because we have such a focus on that user experience, coupled with just, you know, superior care, you know, our churn has been like virtually zero, both on the client side and on the physician side, because you know, we really place a lot of emphasis on making sure everyone has just great experience and that they feel fulfilled in that interaction.
Great. You know, Mehrdad, I think because your focus is a little different. You know, what are your thoughts? You know, sort of about creating that stickiness. I mean, obviously the ROI. You know, when billing increases. Sure, that's very tangible. But you know, are there other things you're thinking about in you know, trying to emphasize the value of what you're creating to create that stickiness?
Absolutely. Yeah, I think that especially when it comes to infrastructure style tools, there is a tendency to have the vendor focus on high level strategic goals, ROI being a classic example of that. For us specifically, we look at the development of an enterprise tool from a vertical perspective. We don't only want to be able to make life easier for an owner or an executive or a senior level manager. We want to make sure that the experience for the end user is incredibly rewarding as well. And that vertical incentive structure is incredibly important in our opinion, because, you know, a happy biller is a good biller. And most revenue cycle tools, clearinghouse tools, just across the board are really poorly designed. It's fairly obvious that they were designed 15 years ago and that many of these organizations may have just told their user experience designers to take the next 15 years off. So we try and actually work directly with the billers to develop the solutions, and then we work our way up. And that way of vertically incentivizing the usage of the platform, we think, and we have experienced, has created a much more rewarding experience for the individuals who use it most, and then the individuals who are responsible for actually monitoring and making sure that the individuals that use it most are doing their jobs correctly.
Great. Okay, well, you know what, maybe in an effort to kind of change the topic a little bit, let's focus on another very relevant issue, and that's big data artificial intelligence, predictive analytics, again, and this digital world that we're living in, you know, the number of data elements that can be captured simply with a keystroke on a keyboard is enormous. You know, and maybe Alon, I'll go to you with this question first. So how important is big data in your world? How important, you know, is predictive analytics? And perhaps you can touch on that as to whether it's important, relevant in your world.
Yeah, of course, it's a great question. I think big data and predictive analytics in those words are enablers to unlock value. And then the question is, what is the value that you want to unlock, or more precisely, what is the pain point that you're trying to solve? And can you leverage those technologies in order to solve this pain point and to unlock that value? So for us, for example, providing visibility to the clinician, to the health system, to the payer, as to whether evidence-based practice was performed in that session is something that you cannot do if you, A, don't have enough data, and B, you don't have the technology to understand that data, annotate it, and leverage and surface those insights. And what we are seeing is kind of this snowball effect, right? So you're solving the chicken and egg problem by having enough data to build your MVP and serve those first clients. And then you onboard more clients, you get more data, you go into the market, and then you have that snowball effect where you creating exponential amount of data with every day goes by and with every client that you onboard. And that data unlocks further opportunities to unlock further value. You know, now we're also providing value on population health level that we couldn't do before because we didn't have enough data, because we didn't serve enough clinicians and clients. And so that's kind of how we look at that, really from the pain point perspective, from the value perspective, and then what are the solutions that you can leverage in order to do that. I think that a lot of the time, there are things like Mehrdad says, where you'll be very surprised to see the solution out there, especially in healthcare. And a lot of the time, you don't even need super sophisticated technology in order to provide 10x better experience, right? You know, if you throw a rock in healthcare, you'll probably hit a pain point. And that's kind of how we think about it a lot of the times.
Great. You know, so that's a great sort of overview, and perhaps maybe Anurag, you know, as you know, thinking about those comments, how does one identify meaningful and actionable data, right? Because I think at the end of the day, we want to identify data that leads to change, either behavioral change or change in a therapeutic regimen, or change, right? Data is data, but it's useless if it's not going to lead to actions. So how do you think about, you know, identifying actionable data, either from the patient side, the caregiver side, the payer side, or the overall system?
Yeah, great question. So healthcare is riddled with data. At every encounter, when you're seeing a clinician, getting a blood test, radiology test, and so forth, there's tons of data, and the rollout of electronic health records has really perpetuated all this big data opportunities. But unfortunately, what we've seen over the past 15 to 20 years is that it's a lot of giga, right? A lot of garbage in, garbage out, and it's hard to create meaningful value out of the data that's in these troves. And at Temba, we think about that a lot because, you know, we're at this really interesting juxtaposition where we're a tech-enabled medical practice in essence, and it's 100% virtual. And so we, being the ones who are providing the care, we've really built out our platform to collect lots of different structured data And because we have these longitudinal relationships with these seniors, we're seeing the same patient visit after visit, and now we're seeing them cross organ systems from psychiatry to cardiology to neurology. We can actually track all different types of clinical outcomes. And we can actually see over time, how are our patients responding to treatments and medications and so forth, and how are their medical conditions changing and evolving over time. So we're really excited about the ability to, at least attempt to create some insights into the well-being, and hopefully, translate that over into predictive analytics, and create clinical decision support tools for our clinicians so that they can provide even better care, even better care regimens as we continue to grow and learn.
Great. I'm looking to see if there are any questions, and I know Lawrence, you had posed a question. I don't know if you want to ask that question now. I'll defer to you, Lawrence, if there is some specific information you want to sort of tease out in the discussion.
Hey, well, I'm happy to ask it live. So I was curious about, I don't know if you saw the question in the chat box. Sales cycle is always a fascinating discussion when you're dealing with any business. And large institutions invariably take a long time to sell. And it's one of these interesting complexities for early stage companies. You're all, getting up and running with a product. I was curious about the customer base that you're selling into, whether it's a health insurance system, doctors, insurers, whoever it is that each of you are selling into. How you tackle that on one side of it. Is the sales cycle particularly long and cumbersome? And Anurag, and Mehrdad, you're both talking about the big data. And you're right, big data has been around in lots of industries. An interesting dynamic in healthcare is obviously HIPAA compliance, what you can do. Presumably that can all be anonymized, and made that simple, so you can use it in an easy fashion. I assume one of the things, Anurag, you were talking about is garbage in, garbage out, is that how one hospital or doctor inputs the data might be a slightly different code than how another hospital inputs the data. So theoretically, you can come up with correlations. If all the data was curated in a very efficient manner, and then it's not garbage in, garbage out, at least it's a consistency of the quality of the data that you're getting. Is there almost a cottage industry of curators, or does everybody, how do you go ahead and deal with this vast amount of data where one person might type in code 181, which is the right thing? I'm not a doctor, I'm making stuff up. But one way of characterizing a particular symptom, and another hospital does it slightly differently. Both are perhaps accurate, but it leads to just messy data. So I'm curious about the concept of big data, gig amounts of data, but how do you curate it? Is there somebody who's tackling that? So anyway, there are two questions for you. I throw it out to the group.
Thanks, Mike.
Yeah, sure. I'm happy to take a stab at that one. So it's, I'll take it in two parts. Going after healthcare providers, in our opinion, is not very different from going after a target prospect in any highly regulated industry. So as I mentioned, we worked in financial technology. We sold to large financial institutions, but large financial institutions were not our first clients, and large hospital systems are not our first clients in healthcare. Who we choose to work with are smaller organizations, ones that are prioritizing efficiencies over the lengthy vendor assessment process necessary to check all the boxes off. And I think that a lot of organizations, a lot of startups that attempt to move into highly regulated industries very often make the mistake of going after the big whales because they think, this one deal is going to set us up for success. And in actuality, what happens is even if you end up getting the big deal, that big deal turns into a very long list of customized features that you have to build for that individual client, which doesn't allow your system to scale very well. So in our opinion, the way that you should grow in these highly regulated industries is to go after organizations that are smaller, organizations that are willing to work quickly, on a timeline that you are setting, and organizations that are willing to accept a generalized system that can adhere to the requirements for software, build it once, scale it, as opposed to going towards more customized solutions for larger organizations. And then when it comes to the second part of your question, Lawrence, about the inherent variability in healthcare information and data, that's a problem that we currently have to work on solving. It's absolutely correct that one organization and one individual within that organization will input information into their EHR differently than an individual in another organization will. And to compound that problem, every single payer has their own way of accepting that information. So it's not like in the financial technology world where, you know, you swipe a credit card and every bank accepts it the same way. In healthcare, you provide the same service, every payer accepts your claim in a different way. And that's very often why billing teams have specialists. So, oh, we have a specialist for United, we have a specialist for Aetna. That to us is a little bit ridiculous. And it goes back to what we were mentioning earlier about acting as an abstraction layer. You let core care deal with that complexity, you provide core care with the same information so that every biller now is going to be standardizing their workflows as opposed to having to specialize it to an individual payer.
I would just add that I'm definitely seeing that problem from the provider perspective. That what you just mentioned, the different types of codes and you know, billing mechanism that they need to think about. And a lot of the time what we do to help them is really trying to standardize things, because you're definitely correct, Lauren, saying that, you know, one provider or one health system can do this, another health system can do that. The only problem is that within that health system, one clinician can do this and another clinician can do that. And so you have so much different layers of complexity and different variables here in the same organization. And so that makes the problem even kind of greater. And I think that's why a core care solution is definitely on spot with that. I would say that regarding sales cycles, we have a very, very important client, which is the social work school here at YU. You know, we managed to land that with the help of Moshe, Maccabi Ventures, and just the whole YU community. And Danielle Ledin is an amazing partner. But that took some time, and in order to do that, we needed to show value. And I think that's the first key step, right? You need to show value. If it's a big organization, you need to do it on a smaller scale. To Moshe's point here in the chat, you should really insist on doing that paid and not free. And I definitely agree with that. But you should show, you need to show the value, and you show the value on a small scale, and then scale that up, especially if it's a large organization. Because, and I think a lot of the time, each company here has multiple value propositions to offer. The only problem is that we need to understand which problem specifically that lead has, and then tailor both the story that we tell them and the pitch and the workflow that they use the product in to meet that pain point. Because I can talk about efficiency, I can talk about effectiveness. I guess Merdad can talk about, you know, improving billing accuracy and revenue and reducing manpower, unnecessary manpower, and Anurag can talk about access and quality. So you really need to understand which exact pain point they have, quantify it in dollars, and then show them the value and getting a percentage of the value that you unlock.
Yeah, you know, that's great. Really great discussion. And Alon, I think I'm going to pick up on something that you just mentioned. And it's sort of the uniqueness of each of the three companies that are, participating today. I mean, I think you each are focused on different segments of the healthcare space and on the administration of healthcare. And maybe we do a little roundtable. Each of you, can kind of provide some thoughts. As you think about all the challenges we've been talking about in this great conversation today, and think about your own company, what have, and obviously the pains and the blood, sweat, and tears that have gone on in your lives to get to where you are today. I know it has not been simple, that I can attest to. So as you think about your company and your particular offering and value proposition to the healthcare community, could each of you reflect upon perhaps what you've learned from adjacent businesses and technologies that have kind of transferred over into your lives as you are building your companies and looking for solutions?
Yeah, definitely. I mean, I think for us, first of all, every day feels like a year sometimes, and every year feels like a day, right? It's moving so fast and then so slowly, all in the same time. And we are learning a lot through the process by talking to smart, experienced people, smart, experienced investors, and talking mainly to our clients and potential clients, and trying to understand what they want us to solve for. On a personal level, I can say that I've seen my friends, I've seen family members dealing with behavioral health conditions. I've seen them not improving. And what we've learned in this journey that we are in for the past 2 years, give or take, is, there are things that can help them. There are best practices. There are things with a very large body of evidence to show that they can improve outcomes much faster than other techniques or other care delivery protocols. What it also showed us, or what we also learned, is for healthcare is just so big. And like you said, there are a lot of different niches, a lot of different verticals. And when you look at each and every one of them, it lacks solutions, it lacks technology. A lot of what you can see that's happening in adjacent market is not happening in healthcare because of that complexity, because of that variability, because of regulation. And I think that Anurag, Mehrdad, and myself, I think, have kind of committed the next 10 years at least of our life to solve those problems, specifically because of that, specifically because it's complicated and someone needs to do that. At least that's how I feel.
Great. Mehrdad, maybe we'll go to you next, because, in the healthcare space, I would say, and maybe incorrectly, that the space of fintech is probably closely related to your focus. And so what have you learned and what have you adopted and transferred over from sort of the fintech industry as you're building your company?
Yeah, absolutely. I think that it goes back to what I mentioned during the initial part of the conversation. For us, coming from the payment space and coming from a world where standardization is built into infrastructure at every step, it was pretty astonishing as we continue to learn more about the infrastructure that has been built in healthcare for payments, how unstructured and unstandardized it is. It's painfully obvious that payments experts were not the ones who developed the reimbursement processes in healthcare. And I think that's to the detriment of literally every single healthcare provider. Could you imagine if you were somebody who owned an online business and it took you hours every single day to get paid? You would just close the business. Why is it? Or
leave the practice of medicine.
Yes, exactly.
Like some of us do.
My father's a physician. My father is somebody who was fortunate enough to go into a specialty that didn't necessarily require him to accept insurance. And very early on in his career, he made the decision to stop because it was so difficult. And that's really awful when you consider how many other very highly talented physicians, organizations, hospital systems have stopped accepting certain types of payers because of how difficult it is. The trade-off, I was speaking with a physician the other day, and he said that they just stopped accepting Medicaid. They know that they can help these patients. They know that they could help them, but unfortunately, we live in a world where we have to make money, and delivering services to one person that doesn't pay versus another one that does, right? So if we can make it easier for everyone to get paid in healthcare, then it stands to reason that you would hopefully have more individuals delivering care, more care being delivered, higher quality care being delivered.
Absolutely.
In behavioral
So I'm
health, it's around 50% that are accepting insurance.
Really?
5-0?
Yeah, 50.
5-0. Okay.
Yeah.
See,
Wow. Yeah, so I'm looking at the clock here, and it's 10 minutes to 1. I want to definitely leave time for some additional questions. We got a couple that I'd like to maybe kind of go to, but before I do that, Anurag, any thoughts about briefly on what you've learned or what you've adapted and adopted from adjacent technologies and businesses?
Yeah, I mean, at Tembo, across our team, we're really leveraging, principles from operational excellence, public health, informatics. I really pull a lot of my experience at Boston Consulting Group in terms of really thinking about how do I drive value for the end user from an operational and strategic perspective. And I think ultimately having that multifaceted approach has allowed us to be much more successful in a much more rapid time period. I'm sure Alon and Mehrdad will agree that one of the strongest assets of a startup is our ability to just move very quickly and adapt. Yep.
Agility.
When COVID came, we were able to really provide just tremendous value and support to our clients. And even now in the past 2 weeks, as vaccinations are being deployed to senior communities, that is a massive logistical issue and problem for these communities to solve, and something that they may not have time and expertise on. But we've been able to really come in and assist there as well. It's been really amazing to kind of see how COVID has really allowed startups to shine in that regard of just moving fast.
Yeah, absolutely, absolutely. Well, so in the last 8 minutes or so let me go to I guess one of the questions, and I will mention the name. I don't know if I should or should not, but a question from Jonathan Bowman. Curious if there are certain vitals or other measurements that show more promise for predictive care. And again, sorry if I embarrassed you, that was not the intent. And I'll start by if I understand the question correctly, one thing I will say is that there's some amazing predictive analytics that can be gleaned simply from the 12-lead electrocardiogram. And there have been some studies that not only can, just by looking at a static 12-lead electrocardiogram that virtually everybody gets when they see the doctor, one can determine age of the individual, gender, and won't even get into the cardiovascular condition. But so yes, there are a number of ways that one can determine and predict things from these large data sets. I don't know, Anurag or others, what are your thoughts about that?
Yeah, so there's a lot of data out there. We're at Tembo, we're really looking at both structured and unstructured data. So, we get vital signs, heart rate, temperature, blood pressure. We get blood testing, urine testing, radiology images and reports. We have EKGs. We actually recently partnered with a really new innovative Israeli startup where we have digital EKG. It's called Smart Heart, and it's phenomenal. It's really simple and easy to use. It's completely digital in terms of data transmission. So Avi, maybe you and I should talk after about taking a look at some of the analytics out of EKGs.
Yeah, absolutely.
But we couple that then also with our doctor's notes, and that's a lot of unstructured data that's in there, and then using like machine learning and analytics, in the future to really pair that together with the structured data and the unstructured data to kind of see what kind of insights can we uncover in the future. Great.
No, that's really important. And yes, we will. Let's connect afterwards. So in an effort to be efficient, let's call it a day. I want to leave some time for Eliza at the end. Let me ask Lawrence, Moshe, any final thoughts from you? Personally, I think this has been a great discussion. The time flew by. I can't believe we now have to wrap it up. So again, I really, from the bottom of my heart, want to thank Moshe, Lawrence, Eliza, the entire YU professional network for engaging me and for asking me to moderate this. I wish you all a safe close and a successful close to 2020, and look forward to hopefully seeing some of you in person soon when the time is appropriate. So thanks, and with that, I'll again, Lawrence, Moshe, Elisa.
Thank you, Avi.
Thank you.
We pass it to Elisa.
Thank you so much. We really appreciate all that you each shared. It's incredibly interesting. I'm by no means a physician, but I've certainly been a patient. So it's very interesting to hear that side of the experience. And I wish you all much luck with your work. And of course, Moshe Bellows, we want to thank you for bringing this to our programming and to our professional networking. It was really wonderful working with you, and we look forward to running more programs with you. And everyone should please stay tuned for additional programs. Hopefully we will have more on health in the field in the next year. And of course, thank you so much, Lawrence, for helping us with all of these wonderful events. And everyone should please keep an eye out for our follow-up emails that come out. We will have a link to our LinkedIn group, and if anybody wants to connect, otherwise they're welcome to reach out to us and we can connect people certainly with each other. So thank you all so much. Wishing everyone a happy Hanukkah, a happy and healthy, safe new year, and be safe out there for those of you who are in New York. So take care, everyone. And if Moshe, any closing words from you? You're good?
No, thank you, everybody. I would just echo what I'm seeing in the chat. If anybody has any colleagues or any, folks that might be appropriate for these 3 founders and their disruptive companies, with pleasure, we're happy to make that connection.
Fantastic.
I'm going to throw one last thing. All these events are designed for it to be win for everybody, win, 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 win. So please, by all means, the panelists have opportunities to connect with 70,000 YU alumni. I'm sure a lot of the people over here, maybe they're investors, maybe they're salespeople. There are wonderful ways for them to connect and be involved with them. With Moshe and what's going on at Maccabee Ventures, there are more great companies that can be coming out here. Connect with Moshe, bring him opportunities. Maybe you can help some of his companies advance. The students. There are a lot of YU undergraduate students who are looking for summer internships. It's a tough period in COVID. Please, anybody out there, I've got a YU student, Avi's got a YU student. Please, fortunately, my son does have a summer internship, but we really would love to hear from everybody about summer internship opportunities, mentorships. And of course, another win is YU itself. Please get involved. Right before this call, I had somebody reach out to me saying, I graduated 30 years ago. I've been attending a couple of these events. How do I get involved and be more involved with YU? Everyone has a different way of getting involved. And reach out to me, reach out to Elisa. I don't work for YU. I'm an investment banker. I'm just passionate about this group and what we're doing over here. And let's all stay in touch with each other. And again, stay safe. Happy Hanukkah, everyone. Happy holidays. And wonderful talk. Thank you all for your thoughtful things. Bye.
Bye.